Like just throw 10 to 12 exams. So 10 exams a day, 3/4 of those exams have malocclusion. Half of them are simple class 1 crowding, right? So what's the opportunity in your practice every day to be addressing both sleep apnea and Invisalign? Huge, huge. Like I chuckled in Dr. Pope in Albuquerque. I said, who's doing Invisalign? He goes, oh, what'd you say? We're doing a lot of.
You know, he's like, what do you do per amount of ortho? He's like, well, how much? I said, I don't know, maybe 5 to 10 a month. And he just laughs at me. Like, what do we do, Matt? 10 a month down there?
Maybe
10?
maybe 10.
Right, and he just thinks that's...
I only laugh because the opportunity is so insane, right? Like if you do 12 exams a day and 3/4 of those patients have malocclusion, your opportunity to have this conversation is like 6 or 7 times a day. A day. And you work how many days a month? 20 at least, right? That's 20 times 7. That's 140 opportunities a month. And he was telling me a lot's 5. So what I'm trying to say is that when you walk out of here, your eyes are gonna be like looking at things a little bit differently and a lot broader, and you'll see more opportunity. Even though you've done a lot, you still haven't even tapped, the possibility of what you can do. And the other thing is, like, the reason it's so awesome in Invisalign and sleep is because it's such a win-win thing, right? Like, you can feel comfortable knowing, like, that when you treat someone's malocclusion, you're really contributing to their health. Like, my whole thing used to be, I'd walk out of the office like, how many teeth did I prep today? Right? Because that's how you figure production. Okay, how many preps did I do? Did I do any extractions? Did I do an implant? At the end of the day, I'm pretty dang tired. I hope it was worth it. Look at the day sheet. Oh yeah, I did 6 preps. No wonder my neck hurts, right? But my whole thing now is to not drill teeth. Like, I think the best approach for dentistry is to keep people in their natural teeth in healthy alignment so that they don't wear out. You're not chipping teeth. We don't get recession. We don't get abfractions. They don't need root canals. They don't need crowns. They don't need veneers. They don't need any of that stuff if the foundation is set properly by you. So dental health is directly related to occlusion. It's the bottom line. I never knew that. But it is the foundation for your patients. If you want your patient to have their original teeth all those decades of their life, they have to hit proper. It's just like your tires in a car. You go out and buy a new set of tires in a car, what's the first thing you do?
Align.
You align and balance them, right? Why do you do that? It's the same thing with teeth, to get them to last. And if you don't pay attention to that, they're not going to last. I was telling some doctors in Nebraska the other night that I had a patient in my chair that was like 90 years old recently. And I had another patient in the operatory next door that was like 20. And I went and did the exam on the 90-year-old, and she was class 1 occlusion. She had no fillings, no abfractions, no recession, no pocketing, no chipped teeth, beautiful smile, right? And then I went next door to a 20-year-old, and this 20-year-old was a train wreck. She had terrible occlusion, recession, abfractions. She already had like 3 crowns and 2 root canals. She lost a tooth. And what's the common denominator? Why does a 90-year-old have a perfect set of dentition and the 20-year-old is just blown out of the water already? Because the 90-year-old had a perfect occlusion. I mean, she had a perfect bite. And if you have a really, really healthy bite, the gum tissue will stay perfect a lifetime. The teeth will last like 8, 9 decades. When I went to dental school, they were like, oh yeah, we want to make sure that we keep our patients' teeth healthy till they're like 60 or 70, right? Because that's how long we figured we had to do it, right? Now you guys, you have to plan for like 90 years. Like your patients, the teeth you're looking at, they gotta last 90 years. And they're not gonna last 90 years unless they're hitting properly and aligned properly, so they can maintain them both periodontally and so they don't wear out. So setting the foundation is what I'm all about. And that whole thing about having the conversation like you had so confidently about the root canal. Your voice changed when you went from talking about a root canal to talking about occlusion. You went from like a strong, knowledgeable doctor to like I don't want to say it.
It's still something I'm not used to.
Yeah, no, I know, that's my point. So it's really, if you want to get into doing more aligner therapy and doing this, you have to dive in, right? Like you notice over your 300 cases that you keep taking on a little harder and a little harder and a little harder. And you're like, why am I taking on this like 8mm deep bite case, or this huge open bite case, or this posterior crossbite case? Because she's willing to take this on and learn and delve into it, that you get better, right? You cannot get better doing Invisalign unless you dive in. Right? You just can't. It's like cooking a meal. You cannot be a good chef unless you cook a lot of dinners, right? It's like, just dive in and do it. Don't be afraid. You're not gonna look, the one thing about doing ortho is that what happens if you treat someone with aligners and after 6 weeks they stop wearing their aligners? What happens? The teeth just go right back. It's not like you're pulling the wrong tooth or doing an endopulpal exposure. You're not gonna like kill this person or get malpracticed upon. This is like kind of safe, easy, gentle, light force movement that's not like crazy, like damaging, reversible, like you're gonna like blow the world up. So dive in and do it, right? And you're taking on more difficult cases every month, right? And sometimes you shake your head, why did I take that case, right? But it's fun, right? Because it's challenging. So this right here today at the end of, after lunch, we have an incredible product at Invisalign now that I have to say, when I first learned about it, when they taught us faculty about it to go out and teach you guys, I'm like, it's kind of a restricting product. It's called Invisalign Go. It only moves second bicuspid to second bicuspid, doesn't move molars. But then I thought about it, I'm like, wow, I wish they had this product when I started doing Invisalign, because it's really, Invisalign Go is a product for doctors that have never done any aligner therapy, and it's a way that you can take pictures or impressions or a scan and get what we call a case assessment, which tells you whether or not it's a predictable case to do Invisalign on without any worry. So an Invisalign Go case, like you'll see how you're going to do an assessment. If it's accepted under case assessment, you cannot fail if you can have your patient wear the aligners. So have you heard about Invisalign Go yet? So it's 20 aligners or less. It only moves second bicuspid to second bi, all green movements. So tooth movement assessment, blue and black, none of those movements are allowed. So they're all very predictable, 100% predictable movements that are done in less than 20 weeks. And all you have to do as a doctor is get your patient to wear the aligner and you have success. Because we have 7 million cases that have been completed in Invisalign in our data bank, and we run artificial intelligence and algorithms, whatever that means, on these cases, we can tell you that based on our artificial intelligence that we know that this type of movement is fully predictable if the patient wears the aligner. So all you have to do is, you see a patient, you either take pictures, impressions, or a scan. I'll show you how to do that. You do a case assessment. It says it's green to go. You push accept, you get the aligners, you hand out 20 aligners, and you're done and you're successful. And it's a great product to set up pre-restorative. If you're going to do some veneers and the teeth are not in line, you want to just do it so they're either prepless or not a lot of drilling has to be done. It's a great product for that. But for a new provider who's never done Invisalign, it's an incredible product because you're not at risk. All you're at risk for is making sure your patient wears their aligners, except when they're eating and being a cheerleader. We'll talk about compliance and how we get people to wear aligners. So this right here, I'll give you just a couple examples. This right here is what an Invisalign Go case looks like. It's really just a mild 20 aligner, mild crowding type of case. And one thing that aligners do really, really well is that they can push teeth in the back up, called expansion, when we tip teeth out, and when we tip teeth out in the front, called proclination. Those are your 2 ortho terms today. But aligners do that great, right? You know that. Like if you see teeth that are lingually inclined and you use aligners, you know it's going to upright them, right? And if you upright teeth, what happens to the arch length? Like what length of arch is longer, that one or that one?
Right.
And what determines whether or not teeth can line up in an arch? Like how long the arch is, right? Because teeth are a certain width. So to understand how crowding works with orthodontics, you have a short arch length because teeth are leaning in. And when the arch length is short, the teeth can't get side by side and line up because there's no room for them, right? So how do you make room for crowded teeth? You just expand them out and make a larger arch length so that the teeth can get side by side straight. The moral of the story is that aligners are incredible at uprighting and proclining teeth. It's what they're best at. So simple crowding cases like this, where you're simply just taking the aligner and moving the teeth out, like uprighting and pushing them forward and increasing arch length, is a beautiful thing to do with aligners, and it's totally predictable. Like this case right here, you could do in your sleep, like walking backwards chewing gum. There's no thought process in this case. This is take a scan, do a case assessment, it says it's good, order the aligners and hand them the aligners and get successful. These movements are 100% predictable. You will not fail if your patient wears the aligner. It's that simple. I show this slide not because I'm all about money, because I think you can do Invisalign and have it be win-win-win for everyone. Win for the patient because they get a healthy smile that they're loving and they're proud about, that they can maintain periodontally. You win because you get to create a great foundation to do more dentistry and you feel good about what you've done. And Align wins because you're doing more Invisalign for the company. And as a doctor, you're making more money because, look, doing ortho is very productive. I can produce in 2 days doing Invisalign what you can do in a month without bending over. And every case you do, I mean, it's not about money, but I just want you to know there's a lot of profit in it. You should, if you're doing Invisalign, we're usually like around $1,100, $1,200 an hour production doing Invisalign without giving shots, bending over, drilling, all that. It's good production, right? It's feel-good production.